Hello and welcome to Medical Dialogues. I'm Anshika Mishra. Here's what I bring to you from the world of medicine. Study finds excessive salt consumption may raise stomach cancer risk. A long-term study by MedUni Vienna, published in the journal Gastric Cancer, revealed a link between high salt consumption and stomach cancer. In the list of the most common type of cancer worldwide, stomach cancer is in 5th place. The risk of this tumor disease increases with age, but the latest statistics paint a worrying picture of an increase in adults under the age of 50. Risk factors include tobacco and alcohol consumption, overweight and obesity. The fact that a very salty diet increases the risk of stomach cancer has previously been proven in studies with Asian population groups who frequently eat food preserved in salt, heavily salted fish, or extremely salted marinades and sauces. Excessive salt intake can have several adverse effects on overall health. It can lead to high blood pressure, a major risk factor for heart disease and stroke. Additionally, too much salt can contribute to the development of kidney disease by putting strain on the kidneys and increasing the risk of kidney stones. Excess salt intake has also been linked to stomach cancer, osteoporosis, and cognitive decline.
Are you also aspiring to excel in medical journalism and delve into the intricacies of health and medical reporting? Explore our comprehensive course on medical and health journalism available at the Medical Dialogues Academy. Learn from industry experts who possesses in-depth knowledge and experience in this field. For further details, scan the QR code provided or access the link in the description box below.
Eating disorder common in people with insulin-dependent diabetes, find study. According to a study published in the journal Eating Behaviors, researchers at the University of Eastern Finland found that 1 in 4 patients with insulin-dependent diabetes aged 16 years and older also exhibit some kind of eating disorder symptoms. Eating disorder are more prevalent in people with diabetes than in the general population, and they're also more deadly. Many diabetes-related factors increase the risk of eating disorders, such as concern over shape and weight, a focus on diet and carbohydrate, and difficulties coping with a long-term condition. Certain risk factors, such as high body mass index, body dissatisfaction, deficient coping strategies, and symptoms of depression, are associated with eating disorder of both type 1 and type 2 diabetes. Patients with insulin-dependent diabetes have a unique form of disordered eating, known as insulin omission. Insulin omission refers to intentionally skipping insulin doses to lose glucose calories through the glucose excretion in the urine, leading to weight loss. Intentional skipping or restriction of insulin doses will lead to weight loss, but this also maintains high blood glucose, throwing the management of diabetes off balance, said doctoral researchers Pia Niemela of the University of Eastern Finland. High testosterone linked to risk of atrial fibrillation study. In a study published in journal eClinical Medicine, part of the Lancet Discovery Science, researchers examined the association between testosterone level and the risk of atrial fibrillation in men. Atrial fibrillation occurs when the heart's upper chambers beat irregularly. Atrial fibrillation is the most common type of heart arrhythmia, according to the Center for Disease Control and Prevention. The CDC also estimates that by 2030, 12.1 million people will have atrial fibrillation. High testosterone levels have been associated with an increased risk of atrial fibrillation. Testosterone may influence the cardiovascular system through various mechanisms, including its effect on inflammation and blood pressure regulation. Elevated testosterone levels have been linked to changes in cardiac ion channels and electrical activity, which can predispose individuals to abnormal heart rhythms. Additionally, testosterone has been implicated in promoting cardiac fibrosis, which may contribute to the development and progression of atrial fibrillation. In the aspirin in reducing events in the elderly, which is the ASPRE study, researchers analyzed data from 4,570 healthy male participants aged over 70 with no history of cardiovascular disease or thyroid cancer. Thank you for watching. Stay tuned to Medical Dialogues for more updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.